An overhead injury is any injury that can affect how you're functioning in your day-to-day life, at school, or in the field of play and athletics. If it's pain over your head, whether it's straining a muscle, spraining a ligament, having any sort of impairment that's not letting you function to your fullest on the field, is considered an overhead injury that should be looked at. Some of the most common overhead sports injuries that I treat are overuse, whether it be from little leaguers playing all year round, high school athletes that play on summer and club teams throughout the off seasons and then play in their high school, never really give their shoulders a chance to take a break. Elbows, hands, any sort of overuse injury is probably one of the most common for younger athletes who aren't strong enough and ready to do their sport all year round. Straining of different muscles, whether it be the rotator cuff, your bicep, your tricep, any different of the muscles, are some of the most common injuries that we see with most of the athletes. Physical therapy is the best thing that you can do for sports injuries. One, we can be very specific as to what you need to get back to, whether it's if you're swimming in the specific motions that you need to get back to improve your range of motion in your shoulder, or strength, or baseball, or football, whatever it may be. We look at how you're moving and how we're going to get that better, whether it's strength, if it's range of motion, if it's your posture, if it's how you're moving while playing the sport, and we design specific exercise programs to help get you back to playing or whatever it may be that you're doing in your spare time that needs to improve function with it. So a treatment program may look like, one, it's individualized to the specific injury. So if it's looking at the diagnosis, if it's weakness in the rotator cuff, it's going to involve strengthening the rotator cuff in specific positions that you need to get back to. It's going to involve getting the range of motion in the joint itself together, looking at the strength and stability of your shoulder in an overhead position, right? So not just below your shoulder, but if you're an overhead athlete and that's what you do for your sport, you need to be strong up above your head, not just below your shoulder. So looking at the muscles of your back and how your shoulder blade moves, looking at how your neck moves. So developing treatment plans to improve and work on stability, strength, range of motion, how your joints move and function so that you can perform at your optimum level. So coming to Health Quest for your overhead injury is one of the best things you can do. One, we have therapists that are diverse in many different areas of school, different areas of background, playing different sports. And so we come and look at every injury from a different angle and can develop the best program for each person so that it's specific to you and not just treating every shoulder injury the exact same. So it's a benefit to have so many different therapists who specialize in different areas looking at the same injury and might have different ideas for how we're going to improve on it. So the Overhead Athletic Institute is a transition program that we take our baseball-specific players through after they are done in the clinic. So being a former collegiate player myself and a current baseball coach, we look at what these athletes need to be able to do on the field as far as throwing, one, to prevent injury, and two, to throw harder and perform better. So the mechanics that we show, one, are correct. They put your shoulder, elbow in the right position where you're throwing to prevent injury. Kids are too young in youth baseball and high school. There's too many throwing injuries from overuse and kids throwing improperly that once we've got them back to the level they need to be at as far as strengthening in the clinic and their shoulders moving correctly, they need to be able to take that and bring it to the mound or the field or in the outfield or the catcher, whatever position it may be. It's a lot different throwing and playing catch with your friend versus doing it live in a game. So making sure that the mechanics and the velocity doesn't change when you actually do it in a game versus in the clinic is one of the biggest things that we bring athletes back to. So if it's just a velocity injury, if it's not throwing hard, if you don't know why, if it's a previous surgery, whatever it may be, we bring you back to specific throwing on field and how it's gonna, and giving you the right techniques to keep up with it. So it's an off-season program, throwing program, strengthening, what you should be doing before games, after games, and whatever it may be to get you to the next level. So if you or anyone you know experience a overhead sports injury or sports injury in general, let us know, give us a call. You can schedule a free pain assessment at our clinics anytime. Or if you wanted to get more information about our baseball specific rehab and training, You can set up a free assessment with myself or any one of the instructors through the Overhead Athletic Institute or HealthQuest clinics.